A trip to the doctor, a very common experience for most of us. But what if you're waiting for a diagnosis? This common experience becomes anything but common. Take, for example, my father. My father was one of the healthiest men I knew growing up. Only occasionally would get a cough or a sniffle, and doctors would say it's seasonal or it's allergies. But in reality, my father was misdiagnosed, and his sarcomatoid mesothelioma went undiagnosed so long that by the time they caught it, it was stage 4, and there was nothing left they could do. We had very little time left together. My name is Samantha, and unfortunately, my personal experience is the experience of many others. Which brings me to the topic of my speech today: AI in the healthcare system, a solution for the future. I will be discussing how AIs in the healthcare system save more lives, aid in medical professionals' training and in the field, as well as how AI in the healthcare system is cost effective. So to begin, how can AI save lives? Well, Orlando, Florida, earlier this month, March 11th through the 15th, held a global health conference. Here, the Pancreas Saves program was shown. This special program shows how AI can differentiate between cancerous pancreatic tissue opposed to regular pancreatic tissue, where a doctor would misdiagnose or miss this completely. So what does this do for the patient? Well, the patient is given more time, life-saving time, as well as a quicker diagnosis. And this is only one of many AI programs that are utilized in the healthcare system. Now, what about medical professionals? How can AI help them, or how can they use it in the field or in training? Well, as seen in the picture behind me, is an example of one of the programs that was shown in the same conference earlier this month. It is the VSI Hollow Medicine, a medical mixed reality platform owned by Apoclar. What it does is it uses an unparalleled real-time visualization of patient-specific anatomy. So what does that mean? Well, right here, patient-specific anatomy. Everyone's different, including on the inside. So by having this readily available to the doctors, it is seen as a way to reduce risk of unexpected complications in surgeries in emergency situations, and the surgeons have a higher level of preparedness going into these situations. Now, we talked a little bit about how AI saves lives by giving quicker diagnosis, or how we see here in the picture behind me where AI has programs that help doctors and medical professionals in training or in emergency situations. But what about cost? Now, expense is no stranger when healthcare is not free. So people often go without treatment or filling those prescriptions that can save their life, ultimately resulting in either death or a lower quality of life. Now, the National Bureau of Economics and Research released a paper on such a matter, stating that administrative costs are estimated to be about 25% of all U.S. healthcare spending, where AI could reduce such a burden. So with that in mind, by integrating AI in the healthcare system, healthcare becomes more affordable and readily available, especially to those who can't pay those top premiums or life-saving prescriptions. So in conclusion, by integrating AI in the healthcare system, it will take time, but it can be seen as well worth the time, patience, and work, because by doing this, you provide faster life-saving diagnosis, better high-risk training for medical professionals, and making healthcare more available for the common person. So, what can we take away from this? Well, that AI can be seen as a way to improve the future and provide a better future. And as Forbes Council member Seema Kumar so eloquently stated, AI offers exciting opportunities to solve our toughest healthcare challenges. If we continue to explore AI's enormous potential, we can make strides to improving health outcomes for all. So I urge you, welcome a better future where AI is used as a life-saving solution. Thank you.